First trimester pregnancy, what to expect. The first trimester of pregnancy can be overwhelming. Understand the changes you might experience and how to take care of yourself during this exciting time. The first trimester of pregnancy is marked by an invisible, yet amazing, transformation. And it happens quickly. Knowing what physical and emotional changes to expect during the first trimester can help you face the months ahead with confidence. Your body. While your first sign of pregnancy might have been a missed period, you can expect several other physical changes in the coming weeks, including tender, swollen breasts. Soon after conception, hormonal changes might make your breasts sensitive or sore. The discomfort will likely decrease after a few weeks as your body adjusts to hormonal changes. Nausea with or without vomiting. Morning sickness, which can strike at any time of the day or night, often begins 1 month after you become pregnant. This might be due to rising hormone levels. To help relieve nausea, avoid having an empty stomach. Eat slowly and in small amounts every 1 to 2 hours. Choose foods that are low in fat. Avoid foods or smells that make your nausea worse. Drink plenty of fluids. Foods containing ginger might help. Contact your healthcare provider if your nausea and vomiting is severe. Increased urination. You might find yourself urinating more often than usual. The amount of blood in your body increases during pregnancy, causing your kidneys to process extra fluid that ends up in your bladder. Fatigue. During early pregnancy, levels of the hormone progesterone soar, which can put you to sleep. Rest as much as you can. A healthy diet and exercise might increase your energy. Food cravings and aversions. When you're pregnant, you might become more sensitive to certain odors and your sense of taste might change. Like most other symptoms of pregnancy, food preferences can be chalked up to hormonal changes. Heartburn. Pregnancy hormones relaxing the valve between your stomach and esophagus can allow stomach acid to leak into your esophagus, causing heartburn. To prevent heartburn, eat small, frequent meals and avoid fried foods, citrus fruits, chocolate, and spicy or fried foods. Constipation. High levels of the hormone progesterone can slow the movement of food through your digestive system, causing constipation. Iron supplements can add to the problem. To prevent or relieve constipation, include plenty of fiber in your diet and drink lots of fluids, especially water and prune or other fruit juices. Regular physical activity also helps. Your emotions. Pregnancy might leave you feeling delighted, anxious, exhilarated and exhausted, sometimes all at once. Even if you're thrilled about being pregnant, a new baby adds emotional stress to your life. It's natural to worry about your baby's health, your adjustment to parenthood and the financial demands of raising a child. If you're working, you might worry about how to balance the demands of family and career. You might also experience mood swings. What you're feeling is normal. Take care of yourself, and look to loved ones for understanding and encouragement. If your mood changes become severe or intense, consult your healthcare provider. Prenatal care. If you haven't yet received a COVID-19 vaccine, get vaccinated. COVID-19 vaccines don't cause infection with the COVID-19 virus. Studies have shown COVID-19 vaccines don't pose any serious risks for pregnant women or their babies. Vaccination can help pregnant women build antibodies that protect their babies. If possible, people who live with you should also be vaccinated against COVID-19. Whether you choose a family doctor, obstetrician, nurse midwife or other pregnancy specialist, your health care provider will treat, educate and reassure you throughout your pregnancy. Your first visit will focus on assessing your overall health, identifying any risk factors and determining your baby's gestational age. Your health care provider will ask detailed questions about your health history. Be honest. If you're uncomfortable discussing your health history in front of your partner, schedule a private consultation. Also expect to learn about first trimester screening for chromosomal abnormalities. After the first visit, you'll probably be asked to schedule checkups every 4 weeks for the first 32 weeks of pregnancy. However, you may require more or less frequent appointments, depending on your health and medical history. In some cases, virtual prenatal care may be an option if you don't have certain high-risk conditions. If you and your healthcare provider opt for virtual prenatal visits, ask if there are any tools that might be helpful to have at home, such as a blood pressure monitor. To make the most of any virtual visits, prepare a list of questions ahead of time and take detailed notes. During these appointments, discuss any concerns or fears you might have about pregnancy, childbirth or life with a newborn. Remember, no question is silly or unimportant, and the answers can help you take care of yourself and your baby.